Laser is what we're going to be talking about here, low-level laser therapy as it's called. The type of laser that I have, I'm going to demonstrate in a moment, is called a cold laser because it doesn't generate any heat, or a non-thermal laser. Okay? Lasers have been around for many, many decades. You have lasers to read your credit card. There are surgical lasers, dermatological lasers, military lasers, and there's also therapeutic lasers like the one that I'm showing you here. This is one of many made by this particular company. I've had this laser for 15 years in my clinical practice, 15 years, and I have seen absolutely wonderful things happen with this. I've done a few shows on this in the past, so you can go to my YouTube page and check those out. My most recent show on a great case of concussion. So I literally laser the brain so we can become a laser brain, right? So we laser the brain. Now, not all lasers can you use on the brain. This one you can because it's a low-level laser. This particular one here is 5 milliwatts. 5 milliwatts, which is 1,000 times less than a light bulb over your head, or 10,000 times less than if it's a 100 watt light bulb, or even a 10 watt light bulb, right? So it's 5 milliwatts. Here's just a look of what it looks like. I shine it on all body parts, okay? Now there's only 3 contraindications to using this kind of laser. One is don't shine it in the eyeball, okay? Number 2 is pregnancy. And number 3 is active cancer. Those are the only 3 circumstances that we do not use it, okay? I think with active cancer and pregnancy, it's just out of just being extremely careful when we do that. But I use it on all kinds of different things. So I use it on all body parts except for the eyeball. And I have used it, so I have a brain protocol that I said that I use in concussion cases. I've used it on TMJ. I've used it on dental issues, pre and post dental surgeries. Shine it right in the mouth. I use it, of course, on the spine for all kinds of musculoskeletal conditions and so forth, okay? And so then what is laser doing? So laser, very simply, is adding light energy to your cells. Simple. Adding light energy to your cells. Now your cells in your body, whether it's a skin cell, a bone cell, a digestive system cell, a blood cell, a muscle or tendon or skin cell, musculoskeletal, doesn't matter what that cell is. That cell needs energy. We can get energy from food, convert it into glucose. Glucose goes to the cell and so forth. But we can also use light photons. Light energy to cells. Let's go to the next step. It's light photons. These photons are absorbed by the inside of the cell, the part of the cell that produces energy, and you remember this from biology, called the mitochondria. So the light photons are absorbed by the cell's mitochondria, which allows it to put out more energy. Whatever that cell needs to do, it can now do it more efficiently. And that's a nice thing. Let's say we have a bad skin injury, cut, burn, whatever it is, and in medical facilities, lasers like this one are oftentimes used for bad skin burns and injuries and so forth, and scarring, okay? And what is this doing? Well, if this is a skin cell and it needs to be reproducing, dividing to produce more skin cells, we want that to happen as quickly as possible and as efficiently as possible. Well, that's what the laser is going to do. It's going to add energy to cells so they can continue their division process, so the healing process and the filling in process can happen faster, okay? So we're adding light photons or light energy to your cells. It's going to help the cells improve their functionality, whatever they're going to be doing, and the healing process may happen more efficiently. Okay? So what about approvals for lasers use around the world, but in the United States? Currently, there are 21 FDA clearances for low-level laser on humans. 18 of those 21 were written by this company that produced this laser here. This company is called Urconia. If you want to learn a little more information, if you want to dive into some of the research behind laser, you can go to their website, urconia.com, and they have a variety of information there. Now, this is a bit of an older unit of theirs. It still works completely fine. As a matter of fact, I just had it refurbished. They don't even sell this or make this one anymore. There's a lot of advancements in lasers, and I'm going to have several of those in my office clinically upcoming. So FDA clearances include, one of the first ones was for plantar fasciitis. So they took groups of people and they did laser therapy on some of them and not laser on others, and the ones that received the laser treatment got better faster. Plantar fasciitis, I've used it many dozens of times with good effect, not on everyone, but with good effect in my office. Chronic low back pain. That's one usage that I use laser on all day long in my clinic. I'm doing it on lower back. Most of the time I have it on skin. Oftentimes, depending on the body part, I'm using it through clothing. These are light photons, so it can make it through the weave of clothing. It's more efficient on skin. So I do both in my clinic. So acute and chronic low back pain. Neck and shoulder pain is another FDA clearance for low-level laser on humans. Even toenail fungus has been another FDA clearance. So there's a variety of reasons that lasers can be utilized with FDA clearances. There's a lot of fat loss research out there as well. There's a slightly different laser than this one, same technology though, that's used for fat loss. So those are some of the things that I use it on. Couple of really good concussion cases that I've had. I use it on carpal tunnel. I use it on sprained strains. I use it on tennis elbow, golfer's elbow, a variety of shoulder conditions. As I said before, I use it on concussion, but I'll use it on chronic headache. Of course, a lot of chronic headaches are coming from the upper neck and upper spine. I'll use it on neck, middle back, lower back, hips, knees, feet, toes, all kinds of things. I will use it on the digestive tract. I'll use it on breathing. And now, as I talked about in a prior show with laser, there is now antimicrobial effects of red laser and also violet laser, one of the lasers that I'll be getting in the future. That is a bit of a different wavelength in that spectrum. And the violet wavelength is showing even more antimicrobial properties. The red laser also has this. So I will have protocols that I use this in our days of COVID-19 and so forth. Is this a prevention technique? No, I won't say that. And can I treat people with active COVID infections in my office? No, I cannot. But you best believe that I'm seeing people before and afterward to help their entire body function a bit better. So that's a little bit about laser. And if people are looking for a different type of therapy, something they haven't tried before that has virtually no downside, except for don't use it in the situations that I described earlier. There's no downside. That's one of the reasons I got this laser, is I can use this on a variety of conditions, and there's no downside. So that's just a wonderful thing. There are other lasers out there with more power than this one. This one is called a cold laser because it doesn't generate any heat. So I just have decided to use this one in my particular clinic because it doesn't generate that heat. And that's why I can use it on the brain and for my brain protocols and so forth. So that's a little bit about that. And if you are interested in therapies that aren't traditional chiropractic care, or maybe you've done physical therapy and acupuncture and massage and so forth, and you wanted to try something different, and in COVID, so you're coming into an office and we have these on and so forth, and you don't want even any contact, I don't even have to touch somebody, and I can actually do these laser therapies in my office. So I've used this on hundreds and hundreds of people, seen some really wonderful things happen. I use it in conjunction with all of my other care that I offer in my chiropractic office, and I've seen some really great improvements. So consider that. If you want more information, you can look on my website. You can go to the Urconia website. You can go to the National Library of Medicine here in the United States and look at all the research articles that are there. There are hundreds, if not thousands now. So take a look at that. And that's a little bit of an introduction to laser therapy for humans. I'm Dr. Scott Fuller.